Hi, my name is Nicole Neal, and today I'm going to be discussing the ASLE RISE EHR system as my informatics technology assignment. I'm currently in my second semester of pursuing my DNP in psychiatric mental health. For those of you who I haven't had a class with yet, I'm just going to give you some background about me. I am an eating disorder nurse. I currently work at the Emily Program Outpatient Center in Cleveland, which you'll hear about throughout this presentation because the informatics technology that I implemented was at TEP. Please note that TEP is a shorthand version of the Emily program that you'll hear me use throughout the duration of this presentation. Also, note that any references for information that I cite in this presentation will be listed on the reference slides at the end for review. All right, so on that note, let's get started. The Emily Program, otherwise known as TEP, is a nationally recognized organization for the treatment of eating disorders. Those also can be called EDs. So EDs are a difficult disorder to treat because they are classified as a mental health diagnosis while maintaining severe and possibly life-ending physical complications that require following and treatment by members of the healthcare team. The care provided at TEP at the partial hospitalization level, otherwise known as PHP, involves a treatment team of a medical provider, nurse, psychiatrist, dietitian, cognitive-based therapist, family-based therapist, and movement therapist. However, the need that is not present in most specialties is that not many EHR systems are created for optimum compatibility with varying members of the multidisciplinary team. To be specific, the EHR system used at TEP is called Avatar. Avatar is the EHR system which is most commonly used by therapists and non-medical mental health professionals. So by using a multidisciplinary team approach to treatment while functioning with an EHR system that caters to psychologists, there's an immediate, quite obvious barrier to care that can be effectively improved upon in order to provide better quality patient care. There are many EHR systems that are specifically created for multidisciplinary practices for the purpose of use by both medical and non-medical members of an organization or treatment center's team. For the purpose of this presentation, the ASLE RISE EHR software will be assessed and addressed in terms of improving patient care and quality improvement at TEP and at other organizations with a similar model. What makes this EHR unique is that it is an all-in-one software that is specifically created to serve behavioral health care treatment and mental health providers of all specialties, with one of those specifically being ED treatment. Upon implementation of this software, the processes between every member of the multidisciplinary team become streamlined, which features spanning from scheduling, automatic appointment reminders, therapy and medical-based treatment plans, progress notes, and outcome measurement tools. Additionally, ASLE RISE includes the ability of medication management, withdrawal management, and even e-prescribing through the EHR itself. My Avatar, the current EHR system being used by TEP, is difficult in the sense that it requires a multitude of other softwares to suit all provider needs. Specifically, Order Connect is used for e-prescribing and lab ordering, while communication between staff members is accomplished via Microsoft Teams messaging. It is very important to note that the implementation of ASLE RISE would not only create a system in which all provider-to-provider and staff-to-staff communication is filtered through one system, but it would also improve patient privacy and ensuring that HIPAA regulations are upheld. Microsoft Teams messaging is not a secure system, so for that reason, staff at TEP are required to use initials and patient identification numbers when discussing patient information. This system is fraught with risk for user error, is inefficient, and will be better done through the EHR system where it can be documented thoroughly. So overall, by eliminating third-party websites and programs and consolidating every aspect of patient care and communication into one EHR system, patient care can be improved for the simple fact that there is less risk of provider error when patient information, provider prescribing, and staff communication is consolidated into one system, and technology is being used safely and effectively in place of human providers with a higher likelihood of miscalculations or errors. Technology and healthcare providers are intended to function as a co-functioning system in which workloads are distinguished in a meaningful way, that abilities are utilized in the most effective manner possible in order to accomplish many of the goals outlined by the CMS in their quality initiatives. By acquiring the most functional and appropriate EHR system possible, the computer system will help in processing large amounts of data correctly and efficiently, limiting the number of human errors, decreasing nurse provider fatigue in regards to repeated similar tasks, and provide important clinical information in a timely and organized manner. An additional factor that is specific to TEP and other mental health specialties is the rise of nurse and provider compassion fatigue. Compassion fatigue, also known as CF for short, is a stress that results due to the repeated exposure of traumatized individuals. CF can further be expressed as the convergence of secondary traumatic stress and provider burnout. In summary, it is a state of physical and mental exhaustion due to the provider's failed ability to cope with his or her everyday work environment. CF can lead to a decrease in the quality and standards of patient care, impaired relationship among members of a multidisciplinary team, and the rise of more serious health conditions such as anxiety, depression, and PTSD. This information is vital for a strong correlation between nurses' job satisfaction, work engagement, and self-efficacy, and patient satisfaction has been studied and accepted. The mentioned patient satisfaction scores are particularly relevant, considering that the CMS uses the Hospital Consumer Assessment of Healthcare Providers and Systems survey as the national standardized public report of patient satisfaction in hospital care and is directly linked to hospital reimbursement and funding, which is necessary for continued quality improvement. Furthermore, EHRs like ASLI Rise, when used in the proper setting, aid in easing and enriching human performance. The overreaching and most important factor remains that the obtaining an optimally function EHR system, TEP will create a framework in which prevents staff from sustaining long-lasting harmful effects from empathy fatigue, guilt relating to human error, and an overall increase in nurse satisfaction, as well as accomplish the overreaching goal of providing quality patient care by implementing relevant quality improvement measures that help to create an environment of utmost lasting health for their providers, staff, and patients. The purpose of redesigning a workflow is to improve staff and provider performance while also increasing efficiency. Current workflow at the Emily program and with the EHR system avatar is filled with risks for error and discrepancy, while also being extremely timely and fatigue-inducing for multidisciplinary members of the team. For the purpose of this workflow design, 4 current workflows have been analyzed for the purpose of being improved upon using the introduction of the more appropriate EHR system, ASLI Rise. The workflows being assessed for the purpose of increasing quality improvement and workflow include staff-to-staff communication and provider orders, documentation and organization, medication and allergy management, and lab orders and results. In order to consolidate the information for this presentation and just for time purposes, I'm not going to go through every single workflow design. I have a figure for each one and I'm going to play them now, and I might even add piano music if I'm feeling fancy and if I can figure out how to do that. So don't be disappointed if I can't. Okay. So lastly, we're going to go through an evaluation plan in which the implementation of this new EHR system is explained, analyzed, and clearly identified for use. The formation of the evaluation plan was created from the guided outline provided by the Centers for Disease Control. You can see above for the figure on the screen, for further information about the evaluation plan itself. So the theory of change that is driving this program relates around the proper use of appropriate EHRs to improve the quality of patient care as well as patient outcomes. Although no specific EHR system alone has shown an increase in patient outcomes, EHR systems containing abilities to help promote patient outcomes are numerous. A prime example of this is an EHR tool that was studied to be used in the ICU to promote team communication and early patient mobility, both which have been shown to improve patient outcomes. In the same way, an EHR system to be used when treating eating disorders, a complicated mental health diagnosis requiring intensive medical intervention as well as psychiatric treatment, which improves communication between both of those varying members of the team and decreases the amount of outside systems being used for medical needs such as prescribing and medication management, will ultimately improve patient outcomes and increase the quality of patient care being offered at TEP. This is a theory of change that is intended to be used beyond TEP, including varying EHR systems aside from ASLE RISE that fit each treatment program best. The information obtained, though useful for TEP as an organization, is intended for the purpose of all mental health, specifically ED, treatment centers, and outpatient centers where multidisciplinary members of the team are providing care and using the same EHR. In addition, the long-term effects of patient satisfaction should be studied in the future, considering that with Medicare and Medicaid funded treatments, funding is directly correlated with patient satisfaction. Essentially, the limits of the interpretation of these study results are aiding in the larger picture of staff satisfaction being positively correlated with patient satisfaction, which is a larger discussion that needs to be had when discussing patient satisfaction scores being directly linked to government funding. And this is actually the end of this presentation. So I hope that you were able to follow along through the entire process of the need explained, followed by the implementation, then the actual evaluation. As someone who works as a nurse at TEP, I can say that it is very difficult using a therapist-based EHR system when you're a healthcare provider. And so I know that a system such as ASLE RISE would be super helpful. Hopefully, I was able to adequately explain why a proper EHR system is essential and all the ways that it improves overall patient care with statistical information and data. Thanks for watching my presentation, and I look forward to watching you guys' and reading your comments. So these next few slides that are going to play are just the reference list.